Good afternoon. I'm Dr. Monica Faulkner, and I'm the director of the Texas Institute for Child and Family Wellbeing. And I'm also the principal investigator on this project, the T3C Continuous Improvement Initiative. And I'm going to get to explain to you all about what we're doing. I'm really excited about it, but also let you know like how we got to the name and why we made decisions that we made to get us to where we are today. Before I do that, though, we have a couple of things in terms of meeting logistics. All the links and resources will be shared in the chat box. Uh, if you need any in-meeting support, Christopher from our office is on here. Feel free to message him individually. He's waiting for you. Um, and if you have a question, just add it to the chat box, and I'm going to be stopping periodically so that we can kind of go through what's in the chat box. And then to get us started, just so we know who's on here, I recognize some familiar faces and I'm so excited to see you. But just so everyone kind of gets a sense of who's in the room, if you don't mind putting your name, your organization or affiliation with child welfare, your region, and if you have any burning questions about T3C Continuous Improvement Initiative, please go ahead and jot those down as well in the chat. And so I'm going to just jump into it and tell you a little bit about who we are. So the Texas Institute for Child and Family Wellbeing is located within UT Austin in the School of Social Work. We're a team of researchers and practitioners. We work to develop knowledge to improve how systems interact with children and families. We primarily work around the areas of foster care, adoption, and child maltreatment. I think what's important to know is we're not DFPS. We were kind of brought in to be a neutral party. We're not a provider of services either. We do have people on our team with lived experience working in the system and living in the system, but other than that, we're kind of removed from it. But we are always excited at the chance to get to be involved in helping improve things, and this is a big one. And I'm actually going to do things a little out of order and introduce my team later that are on the call. But it took me a good minute to figure out how best to organize this so that I can give you all the information without it being an overload. So I decided to go back to the basics: who, what, when, where, why, and how. And I'm going to do this a little bit out of order and start with the why. Oops, sorry, my screen wasn't going there. That's our agenda. And we're going to start with the why. So most of us on the call have probably heard of T3C. It's a major system shift, right? So it's restructuring our service delivery model in Texas with the three core components of provider credentialing, universal assessment process, and paying for services packages based on the child's needs. To do that, the system has to match children to placements that will best meet their needs, develop a comprehensive network of quality services, and provide streamlined compensation to providers. The hope is that there's an improved experience for all children, youth, and young adults, and that we see a change in safety, permanency, and well-being eventually. But it is huge. And we know that when you have big systemic shifts like this, nothing ever is going to go 100% according to the way you want it to. And so a part of that realization was, let's just start and have CQI built into the process from the beginning. And let's just acknowledge that we need a feedback loop to figure out how we change what's not working in the system. So continuous quality improvement is needed. And we're not talking about CQI for one particular agency or for DFPS. We're talking about CQI of the whole T3C initiative, not just one entity in it, right? Because different parts have to work together. So because T3C is a massive systems change and stakeholder perspectives are essential in identifying the challenges and informing improvement efforts, our initiative is going to gather data from stakeholders to identify priority areas. We're going to facilitate a structured process to interpret findings and develop recommendations. And then we're going to provide recommendations to inform DFPS decision-making on strategies for improvement so that stakeholders commit to coordinated actions to support the improvement of T3C. And hopefully that results in implementation that adapts as we go, because 5 years from now, what we see in T3C is going to look different than what we're seeing today. And we want to make sure that the system is continuously adapting to those issues. All right. So now moving to the what. What are we going to be doing? What is this initiative? So when we started out, we were like, okay, what is our vision here? What are we doing for this specific project? So not T3C as a whole, but T3C as a continuous improvement initiative. And our vision is really evolving implementation with data and collaboration. And our mission is to advance data-informed improvements by conducting research and facilitating a collaborative solution building process to improve outcomes for children and families. So historically, we've had program evaluation of big systemic shifts. What we haven't necessarily had is that plus the solution building process to have that feedback loop complete with recommendations that are developed by everyone together. And our goals in this process are to leverage data to guide ongoing improvements and inform actionable recommendations, to facilitate collaboration amongst all the stakeholders to generate solutions, and to provide DFPS and other stakeholders with actionable solutions to prioritize. So all of that is good and well, but we had to spend a long time figuring out how to do that. And that's where I'm going to spend the most of my time talking about how we got to where we're at and where we're going from there. So to build a CQI framework for this, for the whole T3C initiative, we first went back to the literature, looked at theory, reviewed existing CQI frameworks. There are some in child welfare. We know CQI started in manufacturing, right? Where people were like, how do I fix this process of developing a widget? Our process is a lot more complex in child welfare. It's not just about a widget. We have a very complex system that we're working with. And so we decided we would ultimately use probably the most generic framework, which is the Plan, Do, Study, Act framework, but we would adapt it for what we needed. And we also said, hey, we had some ideas about how this might work, but we really wanted to talk to people in the field to figure out how they thought this should work. And so we went and did qualitative interviews with folks, and we wanted to know from their perspective, how can stakeholder collaboration be strengthened to identify challenges? What mechanisms will allow emerging challenges to be addressed in a timely, coordinated way? Really important, what role should stakeholders and leadership play in reviewing and acting on recommendations? And then how can feedback from frontline staff, caregivers, and youth be integrated into the process? So we talked to different folks. This is kind of just an overview of who we talked to. We talked to DFPS staff. Membership groups, we started to define as provider agencies who belong to groups where they pay for a membership and they're represented through those groups. Partner groups, we just started defining as non-DFPS entities that are still like walking alongside the system. So we included in there like Children's Commission, CASA, lived experience representatives. We knew we couldn't talk to a whole bunch of lived experience representatives at this point, but we wanted to make sure we went to some of the groups and talked to their leadership. We talked to SSCCs and non-SSCC provider as well. And what we found really helped us change the direction a little bit of how we were approaching this. So we heard about past engagement efforts. We heard from people that they felt those engagement efforts lacked transparency, accountability, and follow through. We heard that youth and families were often excluded from meaningful participation because discussions were at a higher level and people didn't think or weren't able to bring them into those discussions in a meaningful way. We also heard about research fatigue, people saying, hey, I complete the survey, but I never really see the results of it. And I totally understand because I know our team has asked some people on this call to do like hour-long surveys. And we agree and think that that's really valuable, that, presenting the feedback back to people is critical. So from this, we gathered that we wanted to make sure we could include everyone in a meaningful way. We had initially thought about creating some sort of structured advisory committee to lead the project. And then once we really thought about it and how complex that could be, we decided that we're just going to cast a wide net with our data collection and let people volunteer to be a part of the subsequent qualitative and solution building pieces that I'll talk about. But it changed how we were going to approach it. Another thing that we heard was, which I had never heard before, but CQI being used as a verb. So people talking to us about how they were being CQI'd or CQIing, and there was a huge negative connotation around just the word CQI. So our initial name had CQI in it. And then we decided, let's back up from that because it's also confusing because within T3C, people were asked to provide CQI plans as part of their agency. And so there's a lot of layers in there. We wanted to make sure that people understood that we're not DFPS. So CQI in this context, there's no punitive actions attached to it because I have no power. Our institute has no power to do anything like that. So it's truly just a true collaborative, let's come together and provide feedback. So that's why we changed our name, and that's why you don't see CQI in the name, because it had become a verb at the time we were doing our research. In terms of engagement, we heard there was a little bit of uncertainty about how we could make this realistic and representative, that including different types of providers is really important. And there was skepticism of whether or not we could really do that. But there was also a need for structured collaboration. And so that's where we decided that we would cast that wide net in our data collection and let people kind of volunteer and tell us ways that they want to get involved. And I'm going to talk about that in just a minute. But you can see that this first kind of data that we collected really kind of altered the path that we were going on, I think, for the better. But we also recognize that this is a new and unique thing that we're doing in the state. And so if we need to course correct and adjust, we will, and we'll change it. But here's what we're planning to do. Oops. Sorry, I didn't realize my slides were not advancing, but I got you to the most important one. I'm going to spend a little bit of time on this slide here. So again, we decided to use the Plan, Do, Study, Act kind of CQI process with different steps inside of each of these larger steps. So I'm going to go through and talk about each of them and hopefully do it in a way that everybody understands, but definitely post questions if you have any. So each cycle is going to be about 6 months. We're going to do 2 cycles per year. And the goal is to get data collected and back out into the field very quickly. Normally, when we do program evaluations, we spend a year or two, write a really long report, and then oftentimes the issues that we see in the report, people have already corrected. And so we want to actually get ahead and be helpful and useful to people as they're working through different solutions. So at the start of a CQI process, the planning part is usually about figuring out what intervention you're going to develop. That's already been done for us with T3C. So we're starting here with determining the focus of the CQI cycle. And that in each cycle will be determined by conversations, by what we hear coming out of different meetings, or what we have already gathered from the research that we previously did. So all the research we did to get this set up, we started calling it Cycle 0. And we did hear a lot about T3C implementation in that, even though we were asking primarily, how do we set this process up? So we have some ideas going into this first cycle to help us get started. So it'll be determining the focus. examining administrative data. And right now that's pretty basic. You know, how many people are credentialed? What are they credentialed for? It's very much the data that y'all have also seen. As we move forward, we're hoping to get more administrative data to really look at long-term output impact on kids and their outcomes related to safety, permanency, and well-being. But that's going to come over time. And then in each cycle, we will have a webinar just like this, where we do two things. We tell you what we found in the previous cycle and let you know if we know if anything being implemented or what's happening with that, so that there is that feedback loop. And people alluded to that when we were collecting data, like, hey, I want to know what happens with this. So that is going to be our opportunity to tell you what previously was found and what we know might be happening with it, and then also tell you what we're doing for the current cycle. So that's also what I'm going to be doing today, is telling you the cycle we're moving into and what we're doing. And then we're going to have a survey. And the survey is a very wide net survey. So what we're doing with the survey is opening it up to everybody. It should take between 10 minutes and 15 minutes, depending on, you know, how quickly people get through reading. But we want everybody to take it. So people with lived experience, people working on the front line, all the way to the executive at an SSCC or agency. It's designed for everybody. And it's regardless of whether they have knowledge of T3C, right? So I don't expect an 18-year-old in the who's just aged out to know what T3C is. But what we do want to collect from them, especially in these first cycles, is baseline knowledge and data, so that we can compare over time what those perceptions were, you know, in 5 years from now. The survey has kind of two parts. So the first part of it, we're going to be asking people the same questions each time, so that we are gathering that data that we can look at over time. And then the second part is going to be really focused on what's kind of the nitty-gritty of this cycle that we want to make sure that we capture. The survey is also really important because this is our entry point into people telling us, yes, I want to participate in a focus group, and yes, I want to participate in solution building. So you'll have the opportunity at the end of the survey to let us know if you want to participate in either of those things. And our plan is to, and I'm going to use the cans as an example. I think the cans emerged as something I know we're going to get feedback on in this cycle. And so I'm anticipating we would have a focus group with just cans assessors. So let's say in the survey, someone indicates that they're a cans assessor, and then we ask them, you know, do you want to participate in an interview or a solution building work group related to the cans? And they say yes. And I'm hoping we have like a monster sized list of just hundreds of people who want to volunteer. We're going to randomize that list, and then we're going to start going from top to bottom and just trying to figure out who can fill a focus group, so that everybody has an equal chance to be included in that. And the same for the solution building work groups. So the idea is that that's how we can capture people from all across the system to be included in that. So that is why it's really important to get that survey out there, to make sure people take it, so they let us know what their interest level is. The focus groups and interviews are going to dive a little bit deeper into what we find from the survey. So very quickly, when we have survey results, we're going to adjust our focus groups and interview guides so that we can see, so that we're really honing in on what people are telling us the big issues are. So if for some, you know, if people are like, I don't like the cans, it's not working because of this, then that's going to go in our focus group guide of like, tell me how it's not working in more detail, and let's walk through this. All of that, we're going to put together a data report. It'll be up on our website when it's done. And we're going to take that and create solution building work groups. And this is what I think is the different part, at least for our team. We're used to doing surveys. We're used to doing focus groups. The solution building work groups, we don't usually do in conjunction, right? We do strategy and strategic planning with people, but not necessarily this together. So these work groups are going to be about 10 people who come together virtually and walk through a facilitated exercise to figure out what are the top 3 things we can take out of this that we can recommend today to either DFPS or to other entities on what we need changed to make this work. And so it's really going to be the people in that work group who are going to come up with those ideas and solutions that we can bring forward. And we plan to have multiple, so depending on how things shake out in the focus groups, it might be that we decide to have 4 different solution building work groups based on topics, or maybe it's based on like rural versus urban areas. It's going to depend on each cycle how we structure that. And then we're going to end everything by pulling it together in a report. It will not be a 100-page report. We are going for short and sweet on our website, so that everybody can see what we come up with. And the idea with the solutions is some of the solutions, right, might be things that are not easily solved. It might be that we have to tell DFPS this is what people want, and DFPS says, well, this is a legislative issue, and we've got to go to the legislature. Okay, fine, but we've got it documented so they can decide how they want to do that. But it also might be that in those solution building work groups, people just identify that they just need cross training, or they need like best practices from somewhere. And we can go to maybe one of the membership groups and say, hey, can you help? And then let them take it and figure out how to address that and do that. So it's about bringing people together. And if there's a solution that's workable outside of legislation and going up a chain, that we do that, or we get at least get that started. But for the most part, if there are things that are statutory, that's where it's not a wall, but it's, there might not be immediate return there on seeing something happen. So I'm going to pause there and see, are there any questions in the chat, Nikki, around this? Because there's a lot in this slide.
So far, no, but
Okay.
I just asked everyone to ask their questions in the chat. So maybe as you go on to the next piece, we'll pause again after that piece.
Okay, cool. So let me move into cycle 1, which has already started, and we're moving into the due today, because we're releasing the survey today. So in cycle 1, based on what we've heard and what we've seen at different discussions and meetings with around T3C, the focus is on these big 4 buckets. So we're wanting to know about the credentialing process. How is it functioning in practice? Are there changes that could reduce barriers and provide provider access and navigation of the process in an easier way? How is the CANS currently being completed? What changes could strengthen its accuracy, usefulness, and reflection? And again, we're not grading, right? This isn't we expect you to have all of this perfect. No, 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 no. This is, how is it really happening if you're talking to your coworker and you're saying this isn't working and why can't anyone see this? This is a chance to say what you're seeing and what you're thinking so that it can hopefully be changed. Um, Service plans, I know they're kind of a small blip on the radar screen, but they are part of that universal assessment process. So we want to start talking to people about how those are being used to develop and guide care, what changes need to be made to improve quality and connection to CANS information, and then service packages. How are service packages utilized to connect children with appropriate services? And what changes could better align packages with children's needs and community capacity? So we know right now there's a lot of service packages and a lot of services that just don't exist in communities. But over time, we would hope, right? I think all of us would hope that capacity is built so that we can address some of those more complex needs that some of these service packages are trying to address. So this is a snapshot of right now and helping us get to that point later on. So for this cycle, our next steps, right, and how we do this, we're going to ask you all to take the survey. You are going to be getting an email in your inbox shortly after this webinar closes, if not during it, letting you know that the survey exists. It's going to be open until February 27th. We generally only keep our surveys open for 2 weeks because we After that, like the return is really low on investment there, keeping it open and bothering people with reminders. And we also need to move forward, right? It's rapid data collection. So we want to make sure we get it out quickly. Um, on that survey, again, people let us know if they're interested in participating in a focus group or solution building workshop. And we'll also ask people to sign up for our email newsletter because, or I'm sorry, not newsletter, our email list, so that you'll know every time a survey goes out. If for some reason we're looking for extra people for focus groups or anything, you would get those emails as well. We don't plan to bombard anybody, but we do want to keep people up to date on like what's going up on our website. Then we'll be doing focus groups and interviews in March. And I say focus groups and interviews, we prefer focus groups, but interviews, we know sometimes we cannot. There's certain groups of people, it's really hard to get in a room, like judges or executives. And so we often do individual interviews with those. Um, so we'll be doing those in March, and then be having our first solution building workshops in June. And it's all going to depend on what we find in the survey to what we end up organizing in June. For the survey today, it's open. You're going to get the emails. One thing that I know my research director is staring at me. We are asking you to forward this to your networks. So please get it out to your networks. Please do not post on social media. So again, do not post on social media. We've noticed a problem. Other researchers have noticed a problem when you put surveys out on social media. If there is any incentive attached to it, which there is for people with lived experience in this survey, we will get bots and we will get people who fraudulently take the survey to get gift cards. And they are pretty elaborate in sophisticated in getting those responses in. And so please do not post on social media. We do have ways on the back end that we check for all of those things and we do quality control checks, but it's easier on us if you just don't post on social media. Email is fine. So emailing it out, letting people know that they should take this survey. Please email it out to your frontline workers. We really do need them to participate. We need foster parents to participate. Anyone who's a birth parent, we want their voices. We want youth voices. And they are compensated if they have lived experience. They'll get an electronic gift card. All right.
Monica, we did have one quick question about the T3C application on the T3C website. I know that Casey has mentioned that they are working on improving the
Well,
application process. Do you have any updates from her on that?
no, and I think that's it. When you said application, I was like, we don't have an application because we're not DFPS. So I want to emphasize that, like those questions, I'll have to punt over to DFPS or at the Alliance, they have their T3C group. And I'm sorry, I'm looking at Christine, but I don't remember the name. Um, so I would go there for that sort of information. That's something we're going to be asking about in our survey, but we don't have anything to do with the application. So I don't want to get anyone bogged down in that.
Thanks for that. And Christine's just added a email address to send that question. Thanks, Christine.
Thank you. So I'm going to introduce you to our team because you're going to be seeing them in the future as we go through this process. Um, so this is our who. So you know me now because I've been talking for a little bit. Erica is our qualitative researcher. She is going to be contacting people for focus groups and interviews, and some of y'all she's already met with. Um, Laura is our director of research, and she's a part of everything, all these pieces. And then Kiana is our data analyst, our quantitative researcher. So she is programmed the survey, analyzing that data and administrative data. Swetha, who's on this call, is our project manager. And then Nicole, who's running our chat right now, is our work group facilitator. So she'll be working through and facilitating those using her background in strategic planning and capacity building. And then the when and the where. So I'm almost done. You can see our timeline for our cycles and how they do overlap because we're trying to go fast. And so we're planning as we're finishing one cycle, so that we are getting the information back out. And you can see we're finishing the planning right now, having this webinar, and we're moving into the data collection today with the release of that survey. All right. So next steps, you're going to get that follow-up email from us because you registered for the webinar. Some of you might be on multiple lists, like I see Wayne on there, and I think I have a special email for Wayne and Christine and some other people. So you might get two. Please don't be mad at us. Um, you'll get one for being on the webinar and you'll get one for being in kind of our other lists. Um, we also have a feedback form that Nikki's going to post in the chat for just the webinar today. If you can give us any feedback, any burning questions that you have as you've listened to me talk. And then I put our website on here and we will also post that in the chat so you can link straight to it. This is where you're going to go to get any reports that we have published. They'll be up there. Everything I've talked to today is up there in a CQI plan, and also a cycle zero report is up there to show you if you want to dig into a little bit more about the information we collected. And you have my email, so you can email me any questions you have as well.